How are you today, Dr. Moreno?
Doing good. Good.
So, if I'm correct, if I got the title correct, sir, today you want to share a new study showing the benefits of testosterone therapy.
Yes, yes. And this is actually straight out of the press. Came out from the American Diabetic Association, ADA. Most people are familiar with this federal, guidelines company for. They're not a company. They basically set up guidelines for diabetes, and they had a big meeting in June. Unfortunately, it was a virtual meeting because of COVID-19. And one of the big topics was actually this particular study. It was a 2-year study where they evaluated testosterone plus lifestyle program in reduction of risk of type 2 diabetes in overweight and obese men. So men at high risk for developing or getting diabetes. How did we compare? How did the study do comparing a group of patients that only did lifestyle modifications, which primarily mean in this study dietary guidelines, more like following a Mediterranean diet, versus this another group that did that same lifestyle program but with testosterone therapy. If they qualified the patients to make sure they're appropriate for testosterone, and they had a head-to-head study on that, and they came up with some real interesting things. One of the things they did was, they're basically wanting to see if testosterone therapy with lifestyle modification did better than just lifestyle by itself in progression to developing or getting diabetes. So the way the study was done, just to give you so to show you this is a gold standard investigation. Everything was done to the T, and there's different studies that are done, but sometimes when you break them down, they weren't really done appropriately. This was a randomized study with placebo control. So basically, they randomized patients once they met certain criteria to whether they went to placebo, which in this case is lifestyle by themselves, or the treatment group that uses lifestyle with the testosterone therapy. And it was double blinded. So that means that the investigators or the patients did not know if they were getting testosterone or not. Some of them were getting a shot that was just basically water. The other ones were getting the actual testosterone. And they followed these patients for 2 years at 6 major medical centers. And so basically what they did was this investigation included men 50 to 74 years old, so mid-age to about 74, with waist circumference. So basically the circumference of their waist, or the length of their waist, of 37 inches or more, and an oral glucose tolerance test 2 hours out of 140 to 270. So basically the blood sugar after 2 hours of drinking a sugar load was still elevated at 140 to 270. Usually the gold standard at the 2 hours of drinking, usually this test requires 75 grams of sugar, is for the sugar to come down to about 100. So if these people were still at 140 to 270, that means they're either already have diabetes or in very close to developing diabetes, because they have insulin resistance. Their insulin is not working well, and their sugars are still high even after 2 hours. So these are high-risk patients. The other risk factor was the circumference, more than 37 inches. Ideally, it should be less than 35 inches in a male. Okay, so then and then also the most important thing was that their testosterone levels at baseline, when they got studied on this, when they were included in the study, had to be 404 or less. Now, 404 is very conservative. We see a lot of guys with testosterone at 400, because testosterone has got a wide range in the testing, with the lab, from 250 to 1,000. We've talked about this in other talks. And so 400 is kind of close to the middle, and so, we've always said that, testosterone ideally in a man can easily run 800, 600, 800. I like it over 500, but we're digressing a little bit. So basically, and the lifestyle program that they did on both groups consisted of Weight Watchers. They did Weight Watchers because Weight Watchers is a program where they have to go every week for meetings. So it was very structured, so that was the reason they picked up Weight Watchers. And so basically what they wanted to see is they gave the testosterone to the ones that actually got testosterone undecanoate, which is a type of testosterone that's giving initially in the first month then after 6 weeks, and then every 3 months. And they did this for 2 years on the treatment group. And testosterone decanoate is different than the testosterone that we usually give in the office or that patients self-administer, because it's a big loading dose. It requires longer infusion, or in this case, injection, and it's what they call long-acting ester. So it's undecanoate, not cyprinate. So it is slowly released over time. So ideally, that's actually a really good type of testosterone. Unfortunately, it's hard to get come by and it's expensive, but we can work on with different types of testosterone. So what they ended up doing was they screened up to 10,000 patients. And out of those 10,000 patients, they picked out 1,007 patients for the study. 503 were placebo, and 504 were on the testosterone group. So, basically during the study, they also found that, which was interesting, more people during the study that were in the placebo group, not in the testosterone group, actually discontinued the program. They weren't able to handle the program for 2 years. And that was an interesting finding. They didn't really say why, but I have a feeling that the guys in the testosterone group were more motivated, which happens when you take testosterone therapy, or they were seeing better results, But I don't want to get ahead of ourselves. But that was an interesting finding. They also found that both groups, when they actually went back and looked at more of the data, when they started the program, 20% of them already had like newly diagnosed diabetes, and they didn't even know it. The patients didn't even know it. So what the number one thing to take from this study, what they found, which was crucial, I mean, it was amazing. And this is why it's a big association for diabetes, ADA. And this is a very interesting study. What they found was that the group that was on testosterone therapy decreased the risk of type 2 diabetes at 2 years by 40% beyond lifestyle program by itself. So this is like landmark. This is huge. That's why I'm excited to talk about this, because this is a big difference. 40% less likelihood of developing diabetes just from being on testosterone therapy. And this is head-to-head, both groups on lifestyle modifications, in this case, Weight Watchers. Okay? So on top of that, the people that were on testosterone were found to have much more favorable changes in body composition and benefits in sexual function. And there was reassurance that the people that were on the testosterone therapy did not develop cardiovascular problems. So cardiovascular, it was pretty safe, because that's another concern that we always can have with that. So again, this study, just really hones in the effect of the actual title on this study is Effect of Testosterone Therapy of Type 2 Diabetes Incidence in High-Risk Men Enrolled in Lifestyle Program. So, and this is a 2-year randomized study trial, and you can find this at the American Diabetic Association website. That's why I'm giving you the title of the actual study, so people can actually look at this if they have a chance to kind of go through it. But I'm giving you the highlights of the study, Again, this is a big deal because the ADA is like the biggest association for guidelines, for new recommendations. They're the ones that review all the studies on a yearly basis that are coming out, the most significant studies. And this was all published out of their biggest meeting that they have every year in June, or beginning of the month. Yeah. So a couple other highlights that we actually got from this, but the main one was the one we talked about with the 40% decrease in incidence of diabetes or developing diabetes. And unfortunately, they're saying that by year 2030, they say almost like 50% of the population is gonna have some form of diabetes. The way the obesity epidemic is going right now, they say right now we have about 1/3 of people obese, and out of that, a good half of them already have diabetes. And men are at high risk. So, but one of the things that they found was that the people that were on the testosterone therapy had a 2.1 centimeter decrease in their circumference, or the inches around their waist, just by getting on the testosterone along with the lifestyle compared to the lifestyle by itself only. And the testosterone group had 6 pound greater fat loss in comparison to the placebo group over the 2-year period. So over that time period, they had 6 pounds worth more of weight loss due to just fat, because unfortunately sometimes people lose weight, but they also lose muscle, and you don't want to be labeled as a skinny fat, you look soft, you don't look hard, Um, they also found that the people with the on the testosterone group had 3.8 pounds more of muscle mass gain. Well, the guys in the other ones either lost or just maintained their muscle. These guys gained muscle, 3.8 pounds of muscle weight gain. Not only that, but they also improved grip strength by 4.9 pounds on their grip. The grip was stronger. The ones that they. So these are all things that they watched and looked for while they were doing the study. So, in addition, the people that were treated with the testosterone had improvement in sexual function, satisfaction scores. They had better erectile, function. Orgasmic function was better. They had actual better sexual desire or libido, which, unfortunately, the people that were not on testosterone, in fact, they actually had a negative or worsening in sexual function compared to the testosterone group. So the placebo group actually got worse, while the testosterone group got better sexually. So the other thing that they found was that the guys on testosterone therapy, 52% of them, their blood sugars normalized, after the 2-hour oral glucose test versus 43% in the placebo group. So it's not just blood sugar; it's other things that are improving. The only thing with testosterone is there was some side effects. The main problem with testosterone therapy was that there was 21% of the patients in the testosterone group had an increase in hematocrit. This means their bloods got a little bit thick. So that's one of the things testosterone can sometimes does. And at least I've seen it up to like 5 to 10%, depending on the patient, where their blood counts get a little thicker when they're on testosterone therapy. And we have to monitor that very closely, sometimes by adjusting the dose or having the patient get more of donate blood. But sometimes that can uncover underlying issues with things like hemochromatosis or polycythemia vera. These are conditions where your body's prone by itself to make more hematocrit or red blood cells and can get the blood up a little bit on the thick side. And that's one of the reasons why some people think that testosterone may cause cardiac issues. And that's why you saw something that is preventable that we can treat, that we need to watch out for. And that's one of the things that the other thing that you have to be careful with testosterone is testosterone doesn't cause prostate cancer, but if you have a tendency towards it, or you already have a little bit of testosterone, prostate cancer around the corner, it can add fuel to the fire. It can actually bring it to the picture quicker. In that case, that's why we monitor PSA initially every 6 months when they're on testosterone. I like to do it even up to 2 years just to make sure they're safe. The other thing that can happen with testosterone therapy and the group was some more of them had also increase in prostatic hypertrophy or BPH, because it can cause your prostate to enlarge. If too much testosterone is given and it gets converted to dihydrotestosterone, DHT, by an enzyme called 5-alpha reductase. So if we do a 5-alpha reductase inhibitor like finasteride, we can block that effect, the conversion to dihydrotestosterone, and therefore less incidence of prostatic hypertrophy or BPH. Okay. So again, testosterone has a lot of benefits, but it can also have some side effects that we need to watch out for. And you have to, make sure that the doctor's comfortable working with testosterone. Let's see. So again, going back to the biggest take-home message of this study was that testosterone therapy was directly correlated with the decreasing progression or development of type 2 diabetes by 40% on top of lifestyle. And what's important to note with this study is that this was a pharmacological, what they call a pharmacological effect. It was secondary to the actual medicine. It was independent of whether their testosterone was 300, 200, 400. It didn't matter what their testosterone was. The fact that they were on testosterone therapy actually benefited them, So it wasn't dependent on the levels of testosterone to begin with. So that was an interesting point on that. So, what I want to just kind of bear in mind with this is that, I get a lot of patients that come in and they're pre-diabetic, they're obese, they're having their midlife crisis, they're at their 50s, and they're told, testosterone's 400. It's normal. What are you doing here? Don't worry about it. Just do lifestyle. Just do, you know, just exercise and do the weight program, the diet. That's something you got to do anyway. But if we can improve the progression to diabetes by 40% by adding testosterone, as long as we're monitoring it and maybe getting it up to a more optimal level, we can actually help patients tremendously. So, and this is from the ADA guidelines, American Diabetic Association. So this was a really nice driving point. And again, this is why we personalize medicine. This is functional medicine. We're treating the patient, not the numbers. We're looking at the whole picture. We're taking a good history. We're trying to find out, does this patient have a family history? Does his numbers look like he's going to develop diabetes? Can we help him get to his goal better and feel better? As you saw in the studies, some of the other things got better, sexual function, fat loss, strength. So yeah, now I just want to open it up to any questions.
Doug, you mentioned that people have some misconceptions about testosterone therapy. What are some of the myths of the testosterone therapy that you hear out there?
It's not necessarily a myth. I mean, sometimes, I've treated thousands of patients on testosterone therapy, and you do get a few here and there, 5%, where they're very sensitive to testosterone. You either have to really bring down their dose or change the type of testosterone they're getting, because sometimes instead of an injection, they do better with a gel. Sometimes the guys with the gel don't do well and they do better with an injection. Sometimes they don't do good on either one, and the gel doesn't get absorbed, or the shot hurts, or they don't like getting the shot. Sometimes we put testosterone pellets. We can put in, they look like little Tic Tacs, and they last up to 6 months. People don't even realize that they have those things in there. They forget they're on testosterone. They feel it at 6 months. All of a sudden they come down. And so and there is a few patients that the biggest myth, the biggest concern. It's not a myth. It's a concern. Is there cardiovascular problems with testosterone? Unfortunately, some of the studies before did show that, but they weren't actually monitoring patients' estrogen levels, hematocrit levels. Remember, the blood can get thick. Too much testosterone, if you're not blocking the conversion to estrogen, you get too much estrogen, and too much estrogen could cause blood clots. So too much of anything is bad, And unfortunately, those studies weren't well done, and people were not monitored like they were supposed to, and some of them did have cardiac, problems. So there's also a small percentage of people that may retain fluid on testosterone, and they may have an elevation in blood pressure. So you have to monitor them, especially initially, and go very slow. I like to go slow and build it up. I don't like places where they give them all this testosterone and now they have side effects, and now the patient doesn't want to take testosterone anymore because they're scared. It's better to go slow.
Doug, Scott says, very interesting. How fast on average somebody can expect results?
Oh, with testosterone, usually by the third to fourth week for sure. Some people, they take a little longer. It may go up to 6 weeks. Some people may even notice it within 2 weeks. But usually after usually about the third or fourth injection is where people start really noticing improvements like we discussed.
Doc, I've been monitoring the question. I've been listening. I've been absorbing. Mm-hmm. The study was amazing. It doesn't leave any questions unanswered. Basically, just let's make an appointment with Doug and let's find out.
The reason I shared this and I'm so excited about this live feed today is because people can access the study. It's on the ADA guidelines, website. It's a major medical association that monitors diabetes, and it was a well done study. It was a 2-year study with the appropriate parameters. The appropriate patients were picked out for the study. So a lot of times we read studies, but they're not good studies, and they make it to the media, because they have a certain, take on it, but it really comes down to science and what we can do to help the patient, and optimize, and personalize their care, not just everybody fits the same amount. Oh, we got to wait till their testosterone's 300 or 200. No, we could treat sooner than that and get patients, better results.
Doc, you answer all the questions. Any last words before you leave for the day? I know you got patients waiting for you.
Yeah. No, I think that's it. No, I really appreciate you guys tuning in. Appreciate it.
Well, guys, until next time, stay tuned. We're going to make the announcement. We're going to continue with the live streams early in the mornings. And please, we posted some questions about what topics you would like to see. Look for those posts and let us know, because we want to provide information that you want to watch. With that said, see you next time.